So welcome everyone to today's webinar, and I'm Dr. Lopamudra Das Roy from founder and president of Breast Cancer Hub, and we are we are collaborating with Choir Nilayam to organize this session today. So before we hear a few words from the Choir Nilayam team, I would like to just give an overview of who we are, what Breast Cancer Hub is. Breast Cancer Hub is a GuideStar Platinum certified 2021 top-rated 501c3 nonprofit registered in North Carolina, USA. Our mission is to help make sustainable changes working at the grassroots level by bridging the gap between the developed and the developing countries. We focus primarily on breast cancer in women, men, and LGBTQ plus community, and we support all types of cancers through our mission of awareness, education, research, community outreaches, screening camps, and we always take accountability. We give all our information so that anyone wants to reach out to us, we are always there to navigate them and guide them towards the affordable resources. We have tremendous we function like we have the support groups, localized support groups, but we also have a very private WhatsApp group, and we though we are from different corners of the world, we function like a family where I do a lot of one-on-one counseling, but our support groups have got oncologists, nurses, and also the survivors. Their viewpoint works like magic for the cancer patients fighting during that phase. Now we have adopted villages for door-to-door breast cancer and other cancer test screening, treatment, and management. And we also provide financial aid for the underprivileged sectors to the best of our capacity based on our minimal revenue that we have. Now, all our services are free of cost, and all donations we raise through our kind-hearted community members are strictly driven towards our mission, because we do not have any government aid or funding, but we run through our community-driven donors, and we are all volunteers in the organization. So that's who we are. And I would like to invite Riddhi from Choir Nilayam to speak a few words about their organization. And it's an honor to associate with Choir Nilayam. Thank you so much, Riddhi.
Hi everyone, I'm Riddhi. I am a representative from Choir Nilayam. So a little bit about Choir Nilayam. We are an LGBTQ support group in Hyderabad. We started a few months ago, like back in March this year. And our goal was to create a safe space for LGBTQ community members to come together, talk about various issues facing the community, whatever they want to talk about, and provide a space for them to discuss issues that face us personally in our everyday lives. And since then we have grown into a group that we have a magazine. We also are planning to collaborate in doing cultural events and awareness events like this one. And yeah, it makes me really happy to collaborate with BCH. Meeting. Yeah, we generally have weekly meetings during this time, but so yeah, please try to attend our weekly meetings. Also, we have weekly support group meetings every Saturday at 4 p.m. And this week we decided to give Breast Cancer Hub a platform to talk about breast cancer. And please follow us on Instagram. Yeah, Choir Nilayam on Instagram. Yeah. Yeah.
Okay, thank you so much, Riddhi, for the introduction, because it will be helpful for others who wants to reach out to. So yes, that's wonderful. And I'm going to start my session. So I can see a message from Jaya Lakshmi, and you say that I'm not audible. So I'm audible, right, Riddhi?
I can hear you. Maybe.
So I'm not sure. So maybe Jaya, would you like to, if you are connected with the headphone many times, a lot of times if you okay, now I'm audible. Okay, perfect. Okay, so that's perfect. So without further delay, I would like to start today's session, and give me a second so that I can share my presentation. So Riddhi and Jayant and Anubha, you all can see my screen, right? Okay. So today's session is about, of course, breast cancer awareness. And and which is very important, and that's why we all are here. Now, always when, so whatever I'm going to talk about, the awareness, the screening process, the key risk factors, is going to pertain to all types of, for example, communities like women, men, and LGBTQ plus community. And then we will be more specific about the need and what I foresee, what is going on, and how we all can help ourselves, so that we, the LGBTQ plus community, is not susceptible to the development or the progression of breast cancer. So that is the main idea of today's session. Now, before I start, I always, give a tribute to our breast cancer hub advocates, who we lost in 2018 or 2019. So, and it applies to everyone, as I said, right? So, what actually is the current scenario of breast cancer in the developed versus the developing countries? Now, in the US, the scenario is 1 out of 8 women can get breast cancer in their lifetime. But in India, but worldwide, globally, the incidence is increasing. But unfortunately, in the developing countries, especially in India, the death rate is significantly higher. So always wanted to go to the root cause of it. So basically, what I tried to do was understand what are the challenges we are facing in the different provinces of India, and try to find out what we can do to help these women, so that we can, and men too, so that we can detect early. Now, the story of Lotika Das goes like this. So when, her brother-in-law is my friend, so when all these women who we lost, and when we tried to understand why they were detected late. So basically, with breast cancer, there are different stages. There are stage 0, stage 1, stage 2, stage 3, stage 4. Stage 4 means when the tumor from the breast, it has traveled to the distant organs. So it becomes very difficult to cure the patient. So we should understand that from stage 0 till stage 3, we can actually cure the person if we can treat them accurately. Now, the earlier we detect, the less aggressive the treatment is, the better the prognosis is. And breast cancer for sure can be detected early. So that's why we try to generate this awareness. Now, according to Lotika Das, her problem was that she was not aware that a painless or painful lump could be cancer. And even it goes the same way with others, like with Manjeet and others, or whoever we lost. So what happens is that it's not only the taboo, like of course it's the taboo that women do not speak about, or men do not speak, or anyone at the LGBTQ plus community, we do not discuss concerns in the breast. But it's also the ignorance that we are not aware that what are the signs and symptoms, and this could be cancer. Because if this woman had known that she was having breast cancer, she would not have kept quiet. So why doesn't she know? Because it is not being discussed. So that's why it is the responsibility of us to translate this information to the community. Now, again, as I say, as I repeat, like stage 3, like which is stage 0, 1, 2, 3, it has got 3 sub stages. Substage 1, 2, and 3, like stage 3, A, B, C. So the more the prognosis is much better when we can detect much earlier. So when we are detecting it pretty late, at that point it becomes like the cure is there, but there may be chances of recurrences. So that's why we have to be very careful. Now, I'm going to switch gear a little bit. As I always say, that we focus equally on women, men, and all the communities. But when I'm talking about men, the scenario is 1 out of 833 men can get breast cancer in their lifetime. But that data also keeps changing, because the frequency of breast cancer is increasing equally. But in women, of course, is much higher. Now, when I talk about men, the scenario with men is worse than women, because men feel it's a woman's disease and they're more shy to talk about it. Now, if you see this man, Brett Miller, he is the co-founder of Male Breast Cancer Coalition, and so he's also the vice president of the MBCC. Now, he felt the lump at the age of 18. So basically, it's very important that we try to detect, that we try to start the screening very early in the age. Now, the others in this group, they are also like breast cancer patients or survivors. So what I'm trying to say, that breast cancer in men is a real scenario. So when I first came to India, so I felt like I was the first one to talk about male breast cancer, and 99% of the men, they were not even aware. Even in the US, they're trying hard to generate this awareness. Now, if you see this picture of Marlene Washburn on the car, so Marlene's wife is Patricia. She's a very good friend of mine. So what happened was Marlene was fighting for breast cancer for his daughter, but so that was the scenario going on in their home. But eventually, Marlene also had breast cancer. Now, when detected, we just had him for 5 months because it was detected late stage. That means at stage 4 when the cancer has spread out. So Patricia takes the car and travels all across the US so that men get to know that they get breast cancer too. So another important aspect I want to talk about with male breast cancer is when in a family, there are we have our mom, our aunt, our grandma. It runs in the family. We always forget the man of the family. I'm going to talk about the genetics a little bit. What can we do to test ourselves so that we know that we are not carrying certain genes which makes the man equally susceptible to not only breast cancer but also prostate cancer, digestive tract cancer, and other types of cancers. So that's why this is very important. Now, how do I know, right? What are the fundamental challenges that is happening? Now, what I realized was mostly that resonated with me is that most of the women are of the impression that no one in my family has breast cancer, then why do I have to worry about it? The other percentage, what I understood was like mostly in India, the detection was stage 3 or stage 4. Stage 4 means metastasis, and that's why we are losing all these women. Now when we talk about stage 3, that is also like pretty advanced locally. That means the treatment will be more aggressive. But most of the women told me that like many said like I that there's no screening even done. So all these women, so the 99% of the women in India, and of course the men, and it goes the same way, like 99% of the women in India, they don't even go for screening mammogram, which are the protocol after the age of 40. So mostly all the diagnosis is because they were having severe signs and symptoms, which was clinically manifested. Now, this woman over here, like on the most right left hand side, what happened was she was actually having homeopathy. Even when she felt the lump, she went to the doctor. The doctor said that you have to come back for surgery and other procedures. Then they went for homeopathy. So many times what I noticed, another challenge is that because of the fear of all this aggressive treatment, many go for the alternative treatments. I'm not against any of the alternative treatment. I'm in favor of the naturopathy. I'm in favor of Ayurveda in homeopathy. But what happens is that when we have cancer, we have to take the tumor out and we have to really do the conventional treatment. Other challenge is that during the treatment, I've seen many patients taking in parallel the alternative medication treatment for the cancer available. And we do not know the cross reactivity, we do not know the potentiality, how it's going to affect. So that's why we see that many times the sensitivity and the specificity of the treatment that we're trying to do conventionally, that also becomes lower compared to when someone is not taking any other complementary, like a medical treatment. Now, I want to say here we can definitely do all this like homeopathy or little bit of Ayurveda for treating the side effects of the conventional treatment. Like with chemotherapy, there are plenty of side effects, but it is better to avoid the treatment for cancer itself for these different parallel lines going on at the same time. So these were the different things that I felt was very important to bring to the audience because these are small factors, but it adds up. So basically, what is the statistics? Now, in the US, as I said earlier, 1 out of 8 women can get breast cancer in their lifetime. And then we also expect 44,130 deaths, even in the US, though like 80 to 90% of the women are getting their screening done. But the male scenario is also that we expect 530 men death in the US. This is according to the American Cancer Society. But when it comes to the developing countries, that means when we talk about, the like for example, if I'm taking India, Nepal, Bangladesh, Haiti, Suriname, and other countries, definitely the death rate is significantly higher. And according to my analysis, it's not about the socio-economic condition, it's not about the education. It's about the taboo. Like women, even when a lot of times we blame it to the poverty of the country, but I would say that it's more about the culture-induced inertia, is the embarrassment. So I always say that, when a baby is being born, like the mom, we always say like, the best immunity is the breast milk. And the pediatrician, like my father was a pediatrician. I always heard him talking about breast milk. So, that's the best gift. But if something goes wrong in the breast, why is everyone so shy to talk about it? Because that is the main culprit, so taboo and ignorance leading to the late stage detection, and also there's a lack of research. Now, there's a lack of research from the different repositories. For example, what we see as represented, like, yes, the significant, like the 60% is the survival rate of breast cancer in the women in India. But when I'm going to different parts of India, is the data really represented? Because many times I see, like, saying that my like 100% death rate, especially in the rural sectors. So that's why it's important that we bring up then the research in the LGBTQ plus community. And when I try to look up with the India scenario, I hardly find convincing data, and that's why as we are collaborating with Quanila, I'm to work on that area too, because these are the different ways we can bring change in the healthcare policies. Because until and unless we have solid data, scientific data, people will not start to believe in us. Now, breast cancer, when detected early and treated correctly, is absolutely curable. So, what is the screening process? And this applies for everyone. Now, when from the age of 17 or 18, I'm going to describe in detail, we have to do our breast self exam because we have to understand the look and feel of our breast to detect any abnormality. Now, but the standard protocol is mammogram. Mammogram means screening of the breast is the X-ray, low dose X-ray of the breast. Now, like when I talk to many women in India, the perception is that, if there are problems, we are going for mammogram and other cases. Now, screening means that when we do not have any ailments, when we do not have any concerns, we are going for that. So that is what needs to be done. Now, because when we are going for our mammogram, which is the X-ray, even when the tumor is right inside the duct in the breast tissue, our breast is made up of lobules and the ducts. So when it's right inside, then we won't even need the chemotherapy. It's just we have to take the tumor out, or we have to either do lumpectomy, that is taking the lump out, or removing the breast. We call it as mastectomy. And if needed, we are going to do the radiation. So that's why the screening is important, because we can detect at that point when there are hardly any changes coming up. Now, next is that what happened, and also I'm going to talk about a very important sector which hardly is being mentioned, that mammogram, which we know as the gold standard for breast cancer screening, but mammograms can also miss cancer. So what will be the additional screening? But before that, I want to bring up the situation with the younger population. Now, with the younger populace, breast cancer is significantly increasing in all genders, that we should remember this. So what happens is that we always hear in the US, we are trying to go for the clinical breast exam. That means we have to go for a physical every year when the doctor does the breast examination. Now, when I speak about it in India, many reactions of the doctors are patients come and tell them, like if they're trying to do the examination, like, why are you touching my breast? Nothing is wrong in my breast. Or the male doctors will tell me, again, it's a cultural taboo. So that means that instead of blaming our culture, we need to bring a solution, because it's times to make a change in the mindset of our society. So what do we do? So basically, what the doctors do for as the clinical breast exam, the same protocol. What I did was we collaborated with Male Breast Cancer Coalition and Sarah Cannon Cancer Institute. The Kashbom illustration, they did the pictures. So we have one side for a woman and one side for men, which can be used with all genders. So how to do the breast self-examination. The correct protocol in simple words at one stop place, like, both sided for the first time. Now, when we thought about it, like for example, I'm going to now teach you how to do that, because it should start from the age of 17 or 18. So how do we do the breast self exam? Is it something that we suddenly remembered, like, okay, I haven't done it and that's why I have to do it? No, it shouldn't be like that. It has to be post 7 days from the start of our menstrual cycle. for the woman, for the men, and for all genders, with other genders, we just pick a date in the month who, if we are not going through menopause. So for the older women who have menopause, we just pick a date in the month. For the men and other genders, we pick a date in the month. And every month we do like perform, like today, for example, is 30th October. I'm going to do my examination, and then next month again in the same date we have to do it. So that is the protocol, because during the, like if someone is hitting the period, and during that period or before that, during the menstrual cycle, if we are doing the breast of examination, a lot of times there are different hormonal changes, and that can lead to a lot of false positivity, so it will create panic, and that's why we say do it 7 days post menstrual cycle. Now how to do it? So you stand in front of the mirror, take your hand behind your head, and then like look for any signs and abnormalities, any swelling of all or part of the breast, skin irritation or dimpling of the skin. When the skin becomes very like dimple like this, and it's more like the orange skin of the orange, then breast or nipple pain, nipple retraction, that means when the nipple turns inward, redness, scaliness or thickening of the nipple or breast skin, the nipple discharge, any type of discharge other than breast milk, transparent discharge, translucent discharge, bloody discharge, white discharge, anything, we have to be careful. Now, next step is, so this was the, how our breast is like the different, like any abnormalities arising suddenly. Another important thing is inverted nipple that I said. Please do not panic if you're having inverted nipple from the beginning. But if there's a sudden inverted nipple, then you have to go to the doctor. Now, for how to examine, we take our hand behind our head, then from the collarbone, because we always neglect, when we think of breast cancer, we are thinking of the breast only. No, we should start from the collarbone, and also we should not forget the underarm area, because there are lymph nodes. I know patients, no problem in the breast, but there was lump over here in the underarm area. Now, where to do it, basically in a sitting position, or we always prefer a hard floor, because that really helps to detect the minor changes. Now what do we do is, how are we going to do this screening? So we have given in a very nice way the picture through the arrow. That means from top to bottom we have to check for the lump, any. So what do we expect, right? So when we are checking this way, from the collarbone, the chest area, the full breast area, even the mid area in the chest, that is also important to be checked. We look for any lump which can be like a marble, hard like marble, or mustard cyst, which kind of slips in our fingers. So it may be painless, it may be painful. Please remember, cancer can grow silently. So a lot of times, many women tell me that there were no problem. If this was a lump, it was existing, but it didn't give me any pain, so I did not worry. So painless, or most of the time, it is painless. That's why either way, please, if you feel something, wait for 3 4 days. If you see no, it's not going away, go to the doctor. So what do you do after going to the doctor? That is what I'm going to talk about. When you go to the doctor, you don't have to you don't have to take like 10 medications. You have to do the mammogram, which means the screening of the x-ray of the breast, as I explained. So that will help us to detect the lesion if it's there. Now, remember one thing, 95% times this will be non-cancer or benign. That means that this tumor is nothing to worry about it at that point. But I always say that even the benign tumor, please after keep checking, like doing the breast self examination, and also please do ultrasound every 6 months, because the benign tumor, which is non-cancer, may also become cancer. We have a risk of 3 to 4% or 5%. That's why we shouldn't ignore anything in the breast, that any eruption also in the breast. Now, this slide that you see right now is a very important aspect, because many lives we have saved only because of this particular information in the US, and of course globally, that we are doing outreaches everywhere across the world. Now what happens, right? When you feel the lump, you go to the doctor. Doctors are going to do your x-ray of the breast. Now when we do that, as I said many times, our mammogram may miss the cancer. So why does it happen? Now our breast tissues are mostly made up of fatty tissue. When it is fatty tissue, the background appears as dark. But when we have dense breast or fibroglandular tissue, it appears as white patch, as you can see in the picture. But when we have heterogeneous dense breast, it will be all like scattered white, and homogeneous means full dense, full breast is like covered. Now, when we have lesion, it appears as a white dot. So basically, it's finding a snowflake in the snowstorm. Like if you're lucky, if the tumor is right here, then we are safe. But if the tumor is inside that place, then again it is a big problem. So we can't see it like camouflage. So what do we do? In addition, I always tell the patient that please do an additional ultrasound or sonography that will capture if whatever we do not capture through the mammogram. So that is the complete process of the screening. And that point, if we detect any suspicious cases, doctor will take it forward by doing a biopsy that is taking tissue from that particular lump area and checking under the microscope. We do that to work on different markers to confirm that whether it is breast cancer or not. So this is significantly important because many times, like a lot of times when like in India, so here in the US now mammogram is becoming redundant. We are doing 3D mammogram or tomosynthesis, which gives a much better resolution. But in India, we are not having that facility in all the hospitals. So I always tell the patients, please go and to do your mammogram. If you have dense breast, ask for an ultrasound. That will cover up everything. Because you see here, Dr. Nancy Capello, she did her mammogram in 2004. It came as a happy mammogram. And when she went for her clinical breast exam, as I mentioned, another screening protocol, doctor was doing it. They felt the lump and she was detected as stage 3C. Now, she survived, but because of the different, like we lost her recently in 2019, but because of different, when I spoke to her once, she was saying there's so many aggressive treatments that she had to go through, and then going through all the different, even now, even all that years, that led to another type of cancer. So it's always important that, that's why I keep emphasizing that earlier we detect, the better it is. Now, who are at high risk? Whatever I said, right, the screening mammogram is after the age of 40, but there is a vulnerable population because who may be at risk for developing breast cancer or any other type of cancer much earlier. So 5 to 10% of all cancers are inherited. With breast cancer, if we have a history of breast or ovarian cancer, we should always remember to go for a genetic mutation testing, which we call as BRCA1 or BRCA2 mutation, because they can lead to the hereditary breast and ovarian cancer. Now, for example, when this happens, we always forget the son of the family because the carrier can be a mother or a father. So at that point, 50% chances the daughter can also carry the mutation or the son can carry, because if the son is carrying, then he is also susceptible not only to breast cancer, but also prostate and other types of cancer. So if you know families having this history, go and do this panel of testing so that it becomes much more clearer to you. And so that, because that way you get the peace of your mind that whether you have to be proactive, because then you have to go for screening very diligently. Now, there are other high penetrance genes and all of that too. So there's a big panel. I'm not going into the detail, but you can talk to your doctor. So we have different high penetrance and moderate penetrance genes. So it's not only the BRCA mutation that we have to do the testing. Now, for the male scenario, what are the risk factors, right? Of course, the BRCA mutation and the moderate penetrance mutations, but the other risk factors, in addition to the family history and the aging and inherited gene mutation, is radiation exposure. Because we should remember the environment we are working in, and that applies to all genders, for everyone. So basically, a lot of times, like for example, someone in Bangalore told me once that he came to meet me that his mother was having lung cancer, stage 4 detected. She never smoked in life, no unhealthy practices, she was leading a very healthy lifestyle. So when we went deeper, we found out that she was working in a factory where there was smoke coming all the time and no regulatory measures were taken by the company. So I always tell everyone that please be your own advocate, be vigilant, the environment you are working in, the water you are drinking, the food you are eating. With men's scenario, alcohol, because alcohol causes underlying inflammation in the body, and that is a risk factor too. Liver disease, hormonal treatment that I'm going to talk about later on in details, obesity, the weight gain, testicular conditions, and gynecomastia, which is like a little bit of more breast issues that some men can have. So this will be the risk factors for the men. But then, when I talk about risk factor, I'm going to talk in details afterwards, but I always request that please, 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 if you know you have any family history of any type of cancer, please do the genetic testing so that you are aware that, you are not susceptible because of any genetic mutation. Now, how does this breast self exam card work, right? So I'm going to talk a little bit about our grassroots solutions because I expect that, after today, you will also help to spread the word. Now, breast self exam card that we created, we now have it in 24 languages because our India is diverse. We have multiple languages. Now, when we think of English, it's only confined to few communities, which is who are lucky, who are like, I wouldn't say like, who are exposed to the English conversations, they will understand, right? But how can we ignore and forget the local languages? So what I did was when I first thought about it, so when we build this card with our collaborators, my next goal was, how we translate it into the local languages. So now, because of our breast cancer hub volunteers, they stepped up to help in translating from the scratch. We now have it in 24 languages, and we have it almost in all the Indian languages. So, for example, when I'm going to Hyderabad, I'm giving it out in Urdu and Telugu, in Chennai, in Tamil, in Assam, in Assamese, Bengali, Hindi. But is that enough, right? Because just giving out the handout is not enough. So I explain, of course, but everyone, like, if they do not have a phone, but the organizers will have my email address, my WhatsApp number, and they connect to me if any of them, have any ailments or problems. So my responsibility is that trying to navigate them towards the healthcare resources, and they are mostly below the underprivileged sectors. And as I said, our revenue is very low, so we cannot even afford the full treatment of one, which is so expensive. But we try to give them like 10,000, 2,000, 20,000, maximum 25,000 rupees per patient so that we can help to diagnose them. Once diagnosis is done, I try to put them in the scheme, the government scheme, for the underprivileged sectors that we're trying to take care of them from end to end. So others from the urban sectors who listen to my, globally who are listening, so they reach out to me with any problems. I try to guide them and help them in every possible ways, and that applies in today's session also. Now, this is working very good in the US, in India, and of course in Africa too. We are working, in a very massive way in Africa now. So that is really working because this particular piece of paper is saving innumerable lives because we are trying to tell them what to do next. So it's not just that we are going and doing the awareness, we are not just going the screening, but we are taking care from end to end. Now, next step is that one important aspect about the awareness standpoint I want to bring up is, as I speak about the screening, equally important is that what happens when detected, right? There is a feeling of isolation. Now, I want to speak a little bit about palliative care. Palliative care means, when we are detected with any chronic diseases or cancer, it's not about the end stage care. That at that point, the family is shattered. So we need that support from the bottom. We need that support because it's not only just imagine when someone detected what goes through in the family. So we need to give them the support, and that is the palliative care. It's a multidisciplinary, it's a comprehensive support system. So I felt the need of it. So we have different support groups and all across the place, but we also have a very private WhatsApp group that globally we are connected from different regions of India. Because many times when I travel, many women told me, like, what is a support group? They didn't even know that they could discuss something with another survivor or another patient, because that gives them hope. Because that hope is very important. The positivity is very important. So I want to tell you this story of a woman. When I went to see her, she was at the last stage of her life. She was lying on the floor. When I asked, the family thought cancer is contagious. That's why they were keeping her in isolation. Cancer is not contagious. Cancer will never go from one person to another. It will travel within the body and kill us, but it will not go from one person to another. So I put her on the bed, gave her some blankets. I asked her kids to give her a hug. So she died, but with the satisfaction that, she died in the arms of her family. So I always tell everyone that please, like I request the doctors all the time now that when you're talking to the caregivers, explain everything, because a cancer patient needs the utmost love and affection, needs the hug. So when I talked about this story, many patients from the urban sector told me that Dr. Lopa, you're talking about the village. I am a breast cancer patient. I feel that isolation. A lip cancer patient survivor said, I'm a survivor for 5 years. Even today, when I go to someone's house, they're hesitant to give me a glass of water. How unjustified that can be. So, please step up for our community, because there's different, as Kwan Iliam said, the support system, the support group is so important to open up, because many times what we cannot talk to our friends, but a support group will help us, because we think similarly, we are going through the same process. And at that point, someone who has survived the situation with cancer, he or she gives the biggest strength to the patient. So it's very important. Now, that's how we have different support groups, as I showed you. In the rural sector, equally, we have the WhatsApp group, and it works like magic. We publish stories, and these stories are in local language. If someone is reaching out to me from Bangalore saying that, like my grandmother doesn't want to do the treatment because she thinks her friends are saying all hair will go fall off, I send the interview in Kannada where, in her age, a survivor is saying that I have all my hair growing back because I'm a survivor now. So it's the phase of the treatment because of which we're facing these side effects. So that is the power of the inspiring story. So that's why for us, our breast cancer survivors, our patients, or even those we lost, we honor them, we celebrate their life, as I showed in the beginning, because they inspire us to keep our fight going. Now, I want to talk about a little bit about the story of Christine. Now, many times, what we see is that we do not speak or we do not discuss with our kids. I always say our kids give the biggest strength to us. Please do that. Be transparent, So you can see here, strong like mom. So her kids would wear this T-shirt, and she wanted to fight. So it's not only the fight from the community that's the support, but the fight needs to come from within also. Then it will also help with the positivity, helps with the treatment scenario. Many times in India, I have seen marriages getting broken because of detection of cancer. I always say that, if you know a family thinking of breaking a marriage because the would-be daughter-in-law's mother is a breast cancer patient, or she herself, then I always say that you are lucky, because you are going to bring a girl who is totally aware. She is never going to be detected late. And it is only 5 to 10% genetically inherited. But even if she is belonging to that group, she can take a lot of preventative measures. So in the same way, I always show the story of Jessica, such a brave sweetheart. At the age of 25 in 2019, she was detected. She is a survivor now. She survived the breast cancer treatment. But during her chemotherapy, the time she was supposed to marry, she got married during the same time. So cancer is not the death sentence. Cancer is curable, but we also have to be very careful with the follow-ups. That is equally important, because when we survive, we are survivors also. There are many protocols we follow, how to follow up so that the recurrence is not there. What do we have to do about that? So that's why that is another guidance that I give, so that the patients who are in a support group, I tell them, what needs to be done and what kind of imaging technologies needs to be done, what kind of lifestyle you can lead to prevent with the recurrence. So that's why it's not just about the awareness. It's like a whole process that needs to be taken care of. Now, while doing the outreaches, I was traveling to different villages, right? So this was in Assam in 2019. So this girl behind here started to cry after my session. And she said, why didn't you come to my village? Because my mother just died. I told her that I couldn't save your mom, but your no other moms will die from your village. So that's how we started to go door to door. And for these people, their food is the priority, health is the least priority. Even if we tell them that, you might be having cancer, they don't want to go to the hospital. So from home to taking care and taking them to the hospital, making the income certificate so that after diagnosis they can get the government with the support system, everything we are doing. And from one village, now we have adopted 11 villages, and I cannot be more proud of them, because from zero awareness, now everyone is aware from all types of cancer signs and symptoms. If anything goes wrong, they will call us or let us know. So, for example, the oral cancer, we are also doing anti-tobacco campaign in there. So what I'm trying to say is, if this can be the reflection in a span of 1.5 years or more than that, in the villages, in the rural sectors, then in the educated sectors, why can't we do that? It's basically the vigilance, the awareness standpoint, but it should also be like a ripple effect, that whatever I'm telling you today, it needs to spread it out, it needs to spread forward. So that is the intention. Now, here, before I go to the risk factor, another important thing that I want to talk about is the research part that with Choir Nilam in collaboration we are doing, and Anubha is here. She's leading the project for that, and Riddhi is helping a lot with that too. So we have developed a survey. So we are trying to tap into the untapped sectors with the research so that we can bring into limelight the actual prevalent situation so that we can help with changing the healthcare policies. So that is the purpose. We are doing a lot of clinical data analysis, like we are going into doing the epidemiology study, and even the Uttarakhand, the Shimla sector, like Anubha is taking care of it. So we are doing all of that so that we understand what is the screening scenario so that we can represent correctly, so that we can bring more, like, the conventional ways, systemic ways of helping and be providing sustainable solutions. Now, that was all about the screening, what we can do to help our community, plus also, like, like what is the support group, strength of the support group. And no, and that's why I'm so proud of Koani Lam for what you are doing, because that is so, so important. Now, it's the last section, which is the key risk factors and the prevention of breast cancer. How can we do that? A lot of time, many for all genders, it is applicable that they ask me, like, how can we prevent? So I tell them the best is maintaining a very healthy lifestyle. But before that, I also say that we have to understand if we have any other diseases in the body or not, any inflammatory condition. Now, my work on arthritis and breast cancer, so I discovered the molecular mechanism that is when we have arthritis, if we have breast cancer, then the progression of cancer is much faster. And that work got press release in 2012 in American Association of Cancer Research. Now, the reason why I bring it up, because inflammation is very important to be targeted. There are many underlying conditions, because inflammation leads to not only like progression of cancer, but many times it can initiate also, because there are so many like pro-inflammatory cytokines, they kind of feed the tumors. There's cross-reactivity going on. So if we have any inflammatory condition in the body, arthritis or asthma or any other conditions, please know that please try to target that, because when we have cancer, we forget the other disease. But it's very important to slow down the progression of cancer, because by targeting the other conditions too. Now, alcohol. Alcohol, why the rise of cancer? 1 out of 3 people can get cancer. This is in the statistics in the US, like overall cancer. In India, is increasing like crazy. Now, alcohol is not directly linked, but alcohol again causes underlying inflammation. So that is important that I always say, please do not make it a habit. Socially, you are drinking is fine, but always keep a check on the intake of alcohol we are taking in. Now, obesity or the weight gain, again, is underlying inflammation. Race and ethnicity, what is our background? What are the genes that we are carrying? What is the culture we are coming from? The family history and the genetics that I have spoken about. Tobacco. Tobacco is like 30 to 50% of the cancers could be prevented if tobacco was eradicated from this world. Tobacco with the breast cancer scenario is mostly smoking, because smoking also leads to a high risk factor for breast cancer. And please know that smoking doesn't mean that it is only like, many times people tell me that smoking means only like lung cancer. That's not the case. Tobacco intake can cause cancer in any part of the body, especially like not only lung, but other parts also. Chewing tobacco is another thing which causes many diseases. But like we always think that chewing is only over here, but the ingredient of the tobacco byproducts are going absorbed in all parts of the body. So please stop using any form of tobacco, and please circulate that in your network. That will be very, very helpful. Now, the environment we work in, I already mentioned, we have to be vigilant. Like the food we are eating, trying to be more organic. Most important are 3 things. One is the exercise, the stress, and the food, the diet. Now, exercise helps with the boosting the immune system. It also helps with de-stressing ourselves, because stress is a master regulator for not only like the different upregulation of different oncogenic signaling, but also for various other diseases. So we know that, right? So that's why I always request everyone that do some form of movement exercise, which is helping with the circulation of the body. Whatever you want to do, we don't have to run on the treadmill. We can dance. We can whatever way we can, love to do the different forms of exercises. We can do that now. So we can keep doing that now. Stress, so exercise helps with reducing stress. As I said, stress is another factor I always say that contributes. So if we want, we can do some meditation. Yoga also helps in many ways. But the other most important factor is the diet. The lifestyle diet has changed so much in the modern India and in the modern world that is another main reason. The intake of the processed food, the junk food. So what happens is inside our body every day, our DNA is getting damaged, which is going and contributing towards the development of the, because DNA damage means now the signaling will be like, because what is cancer, right? Abnormal division of the cells. Now, when the DNA is damaged, it kind of leads to this abnormal division of the cells. But how do we control it? But because there are different repair mechanisms, there are tumor suppressor genes, DNA repair mechanisms, and other mechanisms going on. But many times that is not enough, because if we're having mutation, if we are vulnerable population, even then, lack of exercise, the stress, unhealthy food, all this leads to the generation of more and more free radicals in the body that you can see. And then our endogenous antioxidant is not enough. And we are also providing a lot of unhealthy food that is increasing the free radicals. So these free radicals will go and damage the DNA, but antioxidants will donate the electron and balance that. So that's why food rich in antioxidants, anti-inflammatory is very important. And how do we get it? Fresh food. For example, turmeric. I'm not saying that using turmeric means we will never have cancer. Then no Indians would have had cancer, right? Because we have turmeric all the time. But what I'm saying is it helps as an adjuvant, as an anti-inflammatory agent. Curcumin, the byproduct of turmeric, is very helpful. When we mix it with the black pepper, it helps with the absorption. Using fresh ginger, fresh garlic, fresh onion in our curry that we use, instead of using ginger garlic paste, which is filled with preservatives. So these are all high anti-inflammatory diet. Curtailing, reducing the intake of sugar, saturated fats, all of the Coca-Cola, all these drinks that we have, beverages, so those are all leading to a very bad, unhealthy lifestyle. So I'm not saying that don't do it, may keep a balance, because always keeping a balance is good. But one person told me that, Dr. Lopa, in one of the sessions, I lead a very healthy life. I do exercise every day for 45 minutes. But does it count? Because after doing the exercise, when I go out, I smoke also. So that doesn't count at all. It's like tobacco and all this, we say I eat a lot of unhealthy food also, but I'm doing exercise. Of course, it's going to help. Exercise will help you to with the antioxidant production, but that doesn't mean that you are allowed to do the unhealthy stuff. So keep a balance. Don't with the food and the other things. Tobacco definitely no, but with the food, always keep a balance and just be vigilant on what we are eating, because healthy lifestyle is very important. Now that was about the in general. Now and that everything what I told in general, key risk factors and all of that is applicable for everyone, for all genders, right? For the LGBTQ plus community, because it's the same thing applied to everyone. But then specifically, I really want to touch base about few things, which is first thing is very limited data. When I try to look up into the what is actually going on in the transgender community, in the LGBTQ plus community, there are few papers which are only like, but I didn't find specifically much from the India data. Few papers that I found, that is from there we can correlate something that with the lesbian and the bisexual community. What I understand is that there is, because this is the same thing, alcohol use, smoking, obesity, higher stress, but a lot of emotional turmoil too, which leads to the higher stress. Because a lot of times, we do not want to disclose the situation, which are contributing towards higher stress, which I feel that it is not necessary, because we all have the right, and this is our body, whatever way we want to foresee ourselves. So that is important, that stress is a regulator. So these are different things that we see more often with the lesbian and the bisexual, saying that this is actually the data that I found out. It's not that I investigated and found this out, because that investigation we are now in the process of we are going to do that. So we will bring a clearer picture afterwards in front of you. Now, nulliparity, one, there's another thing that I want to bring it up. Many times in many sessions, I'm being asked, like those who never had babies, right? Or who didn't conceive, so are they at higher risk? Now I always say that I know women who have delivered babies still getting breast cancer, that is very high. But when it comes to like women who never conceived or never carried pregnancies, for them what I say is that it is hormonal linked, because when we are having the pregnancy, what happens is breast cancer cells many times they have the receptors they express, we call it as estrogen progesterone receptors. And when we are having that exposure to estrogen and progesterone, which is produced by our ovaries for a longer time, that means the longer we are having that exposure, we are at higher risk. So when we have pregnancies, that means during that time our hormonal, we do not have a period, the ovaries and the functionality of our estradiol, estrogen and progesterone is different. So that probably is a help, because that in the long run has an effect. Now, coming to the other sector, because that's why I didn't mention in the earlier sector about the hormone replacement therapy and the contraceptive pills or other hormone regulated contributions. So the transsexual persons or anyone, any LGBTQ plus community, if you're taking any hormones, right? For example, if you want to, like for the trans woman, what happens is the men, they are taking a lot of the estrogen, and it is being seen that if a transgender woman who is taking hormones, they are at a higher risk than a cisgender man. That means that a man who is like this man is trying to be taking all this to become a trans woman, but then compared to a male scenario, because a man is less susceptible to getting breast cancer, but if he is trying to take all these hormones, then he is at a higher risk for sure. But then this risk is lower than the cisgender women. Like with the women, with our natural endogenous way, we are producing these hormones. But if we compare from a male to a female who is a trans, from male who is trying to be a female with this hormone intake, then the probability compared to the woman is less, but compared to the men, the scenario we say is much higher, because those hormones will play a role. So that's why we always say that even from female to male, like when someone female trying to get into the female perspective, so at that time there is a potential, but it is unclear, because we do not know at that point the testosterone how it is going to have an effect. So that study also I couldn't find anywhere. So what I'm trying to say is hormone plays a role. For example, hormone replacement therapy given to the menopause women, we are seeing that in the long run, the prolonged exposure, these women are at higher risk. So those women who are taking the contraceptive pills, there's not significant increase. We do not see that. There are conflicting data, but we also say many times I'm seeing data where they say that in the long run, with this exposure, these women are at higher risk too. So what I'm trying to say is hormones play an important role, because a lot of times our breast cancer cells are fueled because they have the receptors for the estrogen and progesterone. So if we are going through any hormonal treatment for our situation, then please notify it to your doctors, because another challenge that we see in the LGBTQ plus community is we are not as transparent with our doctors, because a lot of times we hesitate to speak about it, because it's important, and this is because of our community, our society. So because if more groups like Kwani Lam are coming up, this will give a voice, because a lot of times the screening is hardly that, and the US data says that even the LGBTQ plus community, the screening is there. They do not go as much for screening because of all this emotional turmoil that they're going through. That's why even the cisgender women compared to the cisgender women, like the LGBTQ, like the lesbians and the bisexual, their screening rate is also low. Their progression is higher because they are detected late. So it's not only about the hormones, right? It's not only about the medication or the drugs. It's also about the social and the cultural aspect that ties up. That is the basic fundamental problem that I am seeing now. The more I'm going deeper into the subject, that is the reason for the late detection mostly. So I would say that, please keep that in mind. If someone is going through these hormones, please notify them that they need to report to the doctor. And based on your discussion, you can take the treatment forward so that you know that you are comfortable, because your own voice, it's your own body. You are the advocate of your own body. What you want to do to your body is up to you, but you have to be knowledgeable, that you have to be informed that yes, this is what is going to happen, because that awareness is needed, which is not there, because hardly any penetration is being done in the trans community, which is more prevalent with the hormone scenario. So, and which is definitely in need, which is the need of the hour. So basically, like that is what I want to tell everyone today, that we are a global community. We work all across the globe. And now I'm starting to work more towards the LGBTQ plus community. But many times, a lot of people ask me that, how do you differentiate, Dr. Lopa, with Breast Cancer Hub? I always say that, why do we have to differentiate? Can't we come together? Because we are fighting for a bigger cause, the cause of cancer. And that's why, what I always wanted to work in collaboration with LGBTQ plus community. And I cannot be more thankful to Anubha, who is present here today, for being like my support system, I would say. And she stepping up all the time. And she was the one to ask me. I said, yes, I always wanted to. I'm doing it, but not in that high pace. So she was the one to connect me to Querny Lamb, giving the address and everything. Then when I emailed Querny Lamb, he was so proactive, so nice, so coming forward to discuss. So thank you so much. And any questions, I'll take it from here.